My name's Gordon Ireland, and my background is I was a missionary son, lived in Nigeria for years, then went to Canada and lived there with a mission school while my parents were in Africa. And through that, learned a lot of things as far as life and belief. And from that, I went to university in the States and got a degree in clinical pharmacology, where I saw patients and was involved with their therapy. And so I'm starting this series looking at medicines and how you take them and what they should mean to you. And what are the things that you need to know when you're taking medicines? One thing that I think is of primary and utmost importance, actually, is the fact that medicines have one thing they're supposed to do, and that's to make you feel better in some way. It might not be emotionally, it might not even be healthy. It might be a number that you're chasing. It could be your high blood pressure that you don't even know you have. So how do you know if they're working? You know, if a doctor comes up to you with a white coat and gives you prescriptions and says, take this 3 times a day, do you get any other information about it? Or do you just go and take it? I think we've all been trained very, very well by the medical profession, of which I'm one, is to say if we give you a prescription and we tell you to take it, then most likely you're going to take it. But why? Do you know what's going to happen to you? How do you know if you're better? How do you know if you've got a side effect from the medication? How do you know if you're taking it correctly? Sometimes you should take it with food. Sometimes you don't want to take it with food, or you shouldn't take it with food. Sometimes you need to have a lot of water to drink with it. Other times you don't necessarily have to. But that one primary aspect is that there should be a positive response from what you're doing. With high blood pressure, you don't know if it's positive or not, but if you take your blood pressure, you then have a monitor system that you know your blood pressure is being kept down by this medication. The question is, are you having any side effects from that? Before you take another medication for the side effect, first of all, you have to know if you have one. I think this is pretty obvious, but it's something I think that we in the medical profession, as well as the people that we treat, are not living up to what we should do. We should train you. I've talked many times at conferences, and one of the things I've said that when people are not in the hospital where you have them sort of as a prisoner to do what you want to with them, and the nurse will come along and put these in their mouths and make sure they've taken them. Once you leave my office or your doctor's office, you're treating yourself. We just expect you to do what we've said. But you're the one who's doing the treating. If you know exactly where we're heading with this medication, and you know exactly what to look for, and you know the possibility of common side effects. One of the things about side effects, I'll say, is that if you've got a 1% side effect, that's not necessarily an uncommon thing. 1% sounds really uncommon. But if it's being taken in 50 million people, 1 in every 100 is having that side effect. You know, so just looking at the percentage, but there's some that are very common, like 20%. Those are the things you should be warned about. You know, this is something that could happen. And if so, here's what to do. Or here's what to look for to show that your treating of yourself is causing some positive aspects of what we've recommended. So with that, I'm just starting off this series to say that that's what I would like to look at and follow up on. and talk a little bit about when you put a pill in your mouth, how does it get to where it's going? What does it do, and how does it get to where you're having the problem? And how do you get rid of it in the body? It's very important to know how it leaves your body, because if you're one of these people who the exit route of that pill is not as quick as most people, well, then you're going to have problems with it, or potential problems. So if it's your kidneys or your liver or whatever, then that's something you should know about. And that's something that I plan on covering on little chunks as we go along, starting with the very basic things and then building on that to give you the knowledge base to take these medicines and to make sure that what they're supposed to do is really happening to you.